heart disease is no longer a problem of old age. In India today, 1 in 5 heart attack patients is under the age of 40, and cardiovascular diseases account for nearly a quarter of all deaths. Behind these alarming numbers lies a lifestyle crisis driven by stress, poor sleep, sedentary habits, and unhealthy diets. Joining us to unpack this growing challenge is one of the country's most respected cardiac surgeons, Dr. Ramakanta Panda. A Padma Bhushan awardee and founder of Asian Heart Institute Mumbai, Dr. Panda has performed more than 31,000 successful heart surgeries with a success rate of 99.8%. In this conversation with ET's pharma editor Vikas Dandekar and me, Dr. Panda shares why younger Indians are increasingly at risk, what we are getting wrong about heart health, and why prevention, not treatment, must become our national priority. It's Thursday, the 25th of June. I am Rica Bhattacharyya. This is the Morning Brief. Thank you so much. It's really a great opportunity, sir, to meet you in person. Absolutely. To start with, sir, one question that is on top of the mind of every Indian perhaps now is that why are so many people in their 30s and 40s seemingly fit, having heart attack? So why is it happening?
Purely lifestyle. Everything related to lifestyle. When I say lifestyle means it includes everything. One is lack of exercise. Number two, the food habits that we are doing. Number three, stress. Number four, sleep. All of them are affected. Now, today, if you see, hardly anybody doing exercise. Number two, the food habits have drastically changed. Everything is going towards more processed food and more packaged food. Lot of sweets, whatever form, whether it is a Coke or a fruit drink, people think that fruit drink is healthy. It's the worst thing because you are taking out the most important pulp and the fiber component and giving only sugars. Now, third thing, the quantity of food also. What's happening is, especially Indian, we try to avoid food and go home, work all day, very late, and go home, eat late night. That's the worst thing to do, eating habits is concerned. And the second part is your stress level. And fourth is one again significantly affecting, which was not recognized till few years back, is lack of sleep and amount of sleep and what time you are sleeping. These are all important. Your body clocks maximum is your 10 o'clock by the time you are supposed to sleep. Right. And hardly anybody I interview sleeps well. And day to day when I do consultation, my OPD, 90% time nobody sleeps better. Rarely I find a person who sleeps by 10 o'clock. Rarely finds a person who sleeps for 8 hours. Same 7 hours of good sleep at 2 o'clock in the night is as harmful as not sleeping also. On top of that, your habits have changed. Your tobacco, smoking, those things have gone up. And youngsters, if you look at it, 80% my youngsters who come for first thing asked, are you working in IT or even finance? You'll be surprised, close to 80% are either from finance sector or IT sector.
In what kind of age group usually?
When I say youngsters, below 35?
Below 35.
Yeah, I'm talking about 35 or 40 max. Yeah.
Worrying signals.
Worrying thing. It's all lifestyle change. Of course, small segment, they will have family history. Within family history also, I have got patients where one patient recently came, he was 72. I was very upset that he did everything possible. But when I looked at the history, two brothers died at 55, one died at 60. I said, why? Because you looked after yourself so well. You have 73 words. So because you have good lifestyle, you postponed it for 15, 20 years.
Yeah, so we've seen like a mushrooming of hospitals around this place. There was nothing when you started here, and
there are only 10 hospitals doing cardiac surgery those days, 2003.
Right.
In private sector, today there are more than 200.
and most of the people believed, why only heart? Most people thought that it is probably not going to work so well. Now we see it's really taken off so well. So the question is, sir, why didn't you want to expand beyond one hospital with so much happening? What was the idea behind that?
See, there are two models. One model is you want to do commercial model, put multiple hospitals. Other model is that of excellence. And I go by the model of excellence. Now, excellence recreating multiple places is impossible. Look at any of the top hospital, Tata Cancer. How many places they are reproduced? You cannot. They have tried, failed.
Even sir, in
Yeah, and Delhi.
Delhi.
None of them are even 25% of that. It's not possible to replicate because it is a culture. To get that culture in a new place is not easy. I'll give the top best in the world. I'm giving the example. Cleveland Clinic. See, when I started the hospital became very famous. Lot of opportunity came. Every day I'll get people calling for franchise model. So I talked to my mentor, Dr. Luke. He looked at me. He said, how many years Cleveland Clinic has been there? I said, that time they have completed 75 years. I said, how many hospitals we have here? I said, you have got only one in Florida. He said, you know that we are struggling in Florida? I said, yes, I know. Even one hospital, they are not able to replicate the excellence of even 25% of original Cleveland Clinic in Cleveland, in Florida. They have put up one Abu Dhabi. They're struggling for the last 5 years. They're not able to replicate even 25% of the excellence. Same thing, Mayo Clinic. They put up one in Florida, they're struggling.
True.
So reproducing excellence is very, very difficult. I'll give an example. Every day, 10 to 10:30, we have got a clinical meeting. Every single senior consultant is part of the meeting. We only talk about quality standards. Today, no hospital in the country thinks about it. It's a known fact that in any surgical patient, a blood sugar of more than 200 at any time is a very big indicator of wound infection. Nobody bothers about it. Now, so much so in USA today, it is considered as a code blue. Code blue is an emergency. 200 sugar means emergency. Everybody does run around, see how to control it. We are having a discussion. So every single consultant was part of it. We decided that 200 for us is not a code blue. Let's keep it 180. So once your mindset is 180, 200 will not go. So what I'm trying to say is that excellence model is produced not by Dr. Panda alone. It is a culture from top to bottom. So we put a system where the quality person is going to daily call them and keep a track and inform the diabetologist so that they will control. So the infection rate goes down. Today we have got the lowest infection rate and we have the least about antibiotics. I'll give you an example of one of the commonest bugs that you know about is a MRSA. Yes. MRSA is the biggest killer of patients. So much I'll not name some of the biggest name hospital have 40 to 50% MRSA in their ICU. Touchwood in ICU is zero.
In Asian Heart is
Zero MRSA for last so many years.
so
Because we are very, very strict. Every patient coming from outside, we screen. Every single doctor, nurse, include Dr. Panda, is screened. They come and put a big stick into my nose every 6 months. He starts with me. Once he starts with you, nobody can say, don't do that for me. So that kind of quality is very difficult to replicate.
How did you manage this hospital infection issue, sir? Because ICU, you know the kind of proportions, and it's very worrying.
Yeah.
Luckily, now we have one product which has come from India's card only Zenix.
Yeah.
But it's a very big danger.
The reason is I'll consider it iatrogenic. So awareness iatrogeny is caused by human beings. Now, people rely too much on antibiotics and used randomly when not required, excessively, without looking at everything. I was just giving example of there's something called Keystone Project that completely changed the mindset of people about the infection. There's an anesthetist in Mayo Clinic. First 5 years, he kept on saying that all these infections are created in the hospital by the staff and the environment. And he was ridiculed by the whole, including his colleagues, hospital administrator, everybody. So finally, he convinced 2-3 people in his team. They showed that over a period of 6 months to 1 year, there are zero infection. Then the administrator woke up, they then started something called Keystone Project in the state of Michigan, which 1,800 ICUs over a 3 months period, zero infection. What does that give? That means we are creating infection. It is only the environment hospital. They formed as a team. And they showed it that over 18 months, they brought down the infection rate by 80%. Even a small hospital, I remember around 15 years back, Jalandhar, they took up the issue. They said that we will not have any urinary tract infection in the hospital. For 6 months, there are zero urinary tract infection. So the infection in the hospital is purely, is a mindset, I very strongly believe. And it has to be top management driven. The owners has to understand the seriousness of this, has to be driven. And it has to be a team effort driven by the whole team. Then only infection will go down. And it's possible. In our hospital, you go every 30, 40 feet, there's a alcohol. Alcohol hand rub is the best way to prevent infection in the hospital. So every single ICU bed, I got an alcohol hand rub attached to the patient's bed. Number two, the area infection happens. Every people used to use, if you see, put an IV line. They just go, don't even wash. They take an IV line and put it. So that anesthetic showed that even as simple as an IV line, you should be doing exactly the way you are doing a heart surgery. So what do you do with the heart surgery? You clean the patient's body, then anybody who is touching the patient use a full gown, gloves, mask, and then you cut it. He showed that even putting an IV line also, you have to wash the patient hand thoroughly. You have to wear gown, gloves, mask. You have to put a pura, drape the whole patient's body around it. So there's no chance anything, anywhere infection coming. They should zero infection. So this is a mindset. Our infection rate is, I can definitely say, is lowest in the country. Touchwood, MRSA is zero. We have zero MRSA infection for last many years.
So the others are what? Pseudomonas?
Pseudomonas are very. Just now I got a patient from outside. The patient had a stent in Nagpur. Within a month, he developed an infection in the stent. We are operating. For that patient, we are treating absolutely as if, all isolation. From day the patient came, stays in isolation. A new expansion, so I'm going to create one full floor for infected patients. So not a single, and that also we are planning to create because for future pandemic also. Because if you see one thing that showed up in this pandemic, none of the hospitals are designed to handle certain surge of infection. So we are planning one full floor will keep for infection, also future pandemic. I always say that if the patient has come walking into the hospital, there is no reason why he should die and go in a
Honest.
Yeah,
Exactly. Right. So, sir, is there no possibility of a second Asian Heart Institute?
Only one I'm doing is Bhubaneswar because of my commitment to my father. When I started the hospital after the inauguration, I was just to a group family photo going. He asked me, "Can I ask you one question?" I said, "Yes, sure." He said, "Who is? Where do you put up this hospital here? Who is here? Your people are there." He said, "Why didn't you do?" So jokingly, I told my father that here I did it in 18 months, and if you do it in Odisha, it would have taken 18 years. Genuinely, it took 18 years. It took 18 years from the time I took a land.
You set up fund there?
I've got to set up.
So you must have had private equity kind of chasing you and
Every week.
Huh?
Every week.
Every week?
and you turn them down saying
I
what?
told. We don't need. Financially, we are stable. We have got enough internal accruals to do our own expansion. I believe one thing, Dhirubhai always say no bads. So the first time when I put a hospital, obviously there's loan we took, etc. After that, no loan. I'm very, even Bhubaneswar project will be done for internal accruals, no loan. The way you take loan is equipments. You take it on all the companies give.
On a long term.
Every company gives. Even in this hospital also, all our imported cath lab, CT scan, MRI, it is a good model. You don't pay a thing upfront. It's a lease rental, kind of. Lease. So usually it is 3 years or 5 years lease you pay them. And the whole amount you pay over 3 days, they give an interest rate, usually 1% less than the market rate. So that itself takes care of 30% of the project. And the land is already there. So my 40% of the project cost already has been taken care of. We need to spend only 60% in the building and this one. So that internal accruals.
What will be the investments?
That we'll see. Right now we are looking at around 120 beds. Overall planning to expand to 400 beds. Just like they were did SNR, I don't want to start very big with a low occupancy. Go for what is the occupancy, put it up, and then go on expanding.
Very interesting.
Yeah, to the extent my project report is also ready.
I mean, a lot of these single specialties are now coming up tier 2, tier 3. The big hospital chains are talking about the huge expansion plans, be it Apollo, be it Aster. All of them are doing it, right? Bajaj is coming with a hospital, Adani's have a plan. And you are saying that replicating the center of excellence is difficult. So what do you see as the biggest challenge? Is it availability of doctors, the quality, availability of paramedics, nursing staff?
All. Getting all of them the best quality doctors, paramedical people, staff, and having the culture. Culture is very difficult. Now we are very clear. I've never put it for a commercial model. I always put it as a standard, as a role model for the whole country, for anything we do. So I'm happy with that kind of model.
But the cost of treatment is increasing across the world. I mean, affordability is a concern, especially in a country like India. What are your thoughts on that, especially in cardiology, in cardiac care?
I'll put it this way. There is no way a country can rely on a private sector to offer the healthcare to the citizen. Not possible. The very simple of the model, if you look at it, private versus public sector. Public sector, your entire building is free, equipment is free, manpower free, doctors fees. What is the total cost? Comes to 80%. Don't expect a private sector, how they're going to absorb that 80% cost and try to be competitive to people. Not possible. The only two-way possible that model is insurance model. Universal insurance, then they go to a private sector to do it. The only way anywhere in the world it has worked well, it is a public sector. And the more important than that is now is more important than disease management is health management. That's the whole country's focus has to be on health management rather than disease management. That's the only way we can deliver and keep the health of the people better. USA, look at how much they're spending.
18%.
Yeah. Still 20-30% of population not covered till Obamacare coming. Even now also they're struggling because there's a co-payment.
Yeah.
Even co-payment, people become bankrupt because of that. So the focus is slowly changing towards health management, not disease management. Disease management not possible because by the time you get disease is too late. The better is that before the heart disease starts, before diabetes starts, or high blood pressure starts, start training, educating people, public and society to improve their health. One simple example, I'll give example, is banning trans fat. It should be banned completely in the country. Banning certain type of food completely. That's the only way you can improve. My favorite talk nowadays is the future of medicine. The type of medicine we are treating today is going to change dramatically at every level. One is monitoring healthcare of the people, one is treatment level, and one in diagnostic, all three. What will happen is today, every week you get at least few patients who themselves diagnose their arrhythmias and irregular heartbeat, etc. from Apple Watch. What I'm trying to say, technology is going to change so much. It will be driven by 3-4 major changing technology. One is speed of communication, 5G, 6G, 7G. Second thing is the computing power. Now, slowly quantum computing is going to become a reality over time. So one will speed of communication, computing power, increasing the speed of calculation. Third thing, AI, helping this. All these things when you come in, the revolution in the monitoring human health is going to change drastically. All you need is a tiny little sensor in under your skin. It's going to monitor your pulse, blood pressure, your entire cholesterol level, sugar level continuously. Then over time, your Apple Watch is going to predict that over next 15 hours or 20 hours, you are going to get a heart attack. Please go to the hospital. That is going to predict the health of the person and predict the any upcoming catastrophic event, or the stroke or heart attack, etc. Second thing, that is also insurance company is going to monitor the person's health and your premium will be linked to that. And there will be a time when your insurance company is going to monitor that you have been very careless. I'm not going to pay you your insurance. This is going to happen. It is over a 10, 20, 30 years. Don't expect overnight it will happen. So insurance companies are going to pressurize people to have a better health. The people themselves will know when there is a treatment required. Then what happens is currently our health is what is called episodic. That means person get a problem, then you go to doctor, see. Doctor solves your health issue, you feel normal, go home. That it could be 2 months, 5 years. That 5 years, nobody knows what is your health. Neither patient knows, nor the hospital knows. So it currently is intermittent episodic, it will become continuous. And the hospital role will change completely. So there are no more you need to admit patient for a long time. Keep them, they go home and get treated with AI, with the robotic assistants coming in, people are going to be taken care of health. My opinion is amazing things going to happen in healthcare, which is going to cut down the cost drastically. And the treatment is going to change drastically after the genome sequencing. Everything is going to change. These are all the beginning of a revolution of healthcare. Same thing you see also going on in the cancer treatment also. Both in the form of immunotherapy, they have been able to cure completely stage 4 cancers with immunotherapy. And one very major area is coming up is your individualized medication. Every human being is different. So already in terms of heart disease, the concept of cholesterol management today is individualized. No more just general. Heart disease, chalo, itna medicine.
One size fits
Is completely one size fits all is completely gone now. I'll give a simple example: level of cholesterol and LDL cholesterol, the bad cholesterol. Earlier you say, okay, keep maintain bill. We started with less than 150, going down to less than 100, then 70. Then still they saw that people are getting heart disease. It's all individualized now. All depends on how much risk factor you are. Somebody has no risk factor, etc. Nothing. You have a day, up to 100, we accept it. Somebody has a small one risk factor, we say, okay, 70 is the upper limit number. Somebody has multiple risk factor, very young age, you say, okay, you can't have more than 30. So it's slowly moving towards personalized medicine.
Sir, how about the obesity drugs?
See, I believe first you do your lifestyle change, then you do that. Not the other way around. People are going for the easy route. Very easy thing is go ahead, take GLP. Like I had one patient, I'll not say famous, a cricketer, he was diabetic very bad. He'll eat whole bunch of sweets and take extra insulin. His wife is said, "Kuch you counsel karo," he does that. It's like that. That you don't change your lifestyle, take GLP to hoping. Yes, it is good, but one thing I caution is, I'll not advise for a mass usage just like that without lifestyle change. Serious side effects also there. People with pancreatitis and other problems are there. For an individual patient, there is nothing called 5% risky. Either 0%, 100%. So from that angle, I'll not advise mass usage. First do a significant lifestyle change, then you add it.
How is a typical day in the life of Dr. Panda?
So the first thing I get up, my exercise. I have a treadmill here, a treadmill at home, everywhere. I have my treadmill. I run on the treadmill for, depending on my time, between 20 to 30 minutes. And then alternate days, I do weight training.
Strength also.
Strength training. And if I don't have time on the car ride home here, 20, 25 minutes, I do my yoga. I got all yoga apps. I'll just do it by close everything, put my this one, I do my yoga on the car. These are a very basic part of my life. So this is my day starts, so this one. And then first thing in the morning, we have my half an hour, I take the hospital operational healing, 9:30 to 10. And 10 to 10:30 there are clinical meetings every day. No, I don't think any hospital in the country has that kind of focus. And the entire focus half an hour is on the quality. 1 week we discuss about research projects, publications. Every Tuesday we discuss about publication. Every Thursday we discuss about infection. So there are quality people, quality head sits outside my office. So they don't report to anywhere. They report directly. Yeah. Many organizations, they have that kind of. It's like auditor don't report. They straight report to the board. They don't report even to the CEO.
Even the USMDA, sir, we've got so many pharma companies getting warning letters. And so they've put it very clearly that the onus of leadership failure in quality lies straight up to the owner.
Yes.
The
So my quality state sits outside my office, reports to me.
So finally, sir, we've heard a lot about your passion for wildlife photography. You've toured the world, you've gone to Africa, you've seen a lot of tiger reserves in India, you've done exhibitions. What was it like? How did you really take up this passion? Tell us all about that.
I've been into photography, but I used to do landscape, macro, and night photography, etc. For 30 years, I've been going to Africa. Again, one of my patients once invited around 96, you come with me, drove me to Masai Mara and fell in love with the amount of animals you say there is a different scale, mind-boggling level. So I have been in love with Africa. I've been going thrice a year since the last 30 years. Around 10 years back, I operated the health minister of MP. He was a doctor, a very nice person. So he invited many times, said, please come with me. So I went with him. Then I got involved there. And whenever I go, I always talk to the lowest denominator, all the workers, etc. Then I realized that the lifestyle, the living condition is so pathetic. Reason is all this national park, they employ the local people. So most of them get 10,000-15,000 rupees. Within that, they have to manage staying their food inside the park and also manage their family. So then I got involved. For a few years, I started giving free food to them. I spent few crore rupees. Then I realized the money is going down the drain. So then I started talking to them, tell me what kind of sustainable income I can get it for you. That's how we started slowly. I made my trust. And like Kana, we put a petrol pump. I give the entire money. So local, their staff welfare association manages many places. I encourage them to form their welfare association like Bandhavgarh did not have. Like Kana petrol pump, they earn around 2 to 3 lakh rupees a month from that. So that goes for welfare association. They make around 30 lakhs rupees. From there, they buy health insurance or somebody has a problem, they do that. So that's how I got involved everywhere. And I do my photographies. Just 2 days back only, I came back from Tanzania.
Tanzania.
Yes. And I got some of the most amazing photos. This again, every time I go, I have a very specific thing in my mind. My one plan was to get a lion. Male lions are usually protected. They protect their cubs and female. They go all the time. Rarely they play with their cubs. Very, very rare. By the time come, they're tired. It's like father, no working 18 hours. No time. Mother looks after the baby. When the baby comes, oh, I'm tired. Don't disturb me. So I very rarely find a tiger, a lion with a cub. I'll get a sneak peek to my next exhibition. My next exhibition is only on the cubs. Wow. This is a dream shot. I've never seen in 25 years. Look at it.
Oh my God. Yeah.
Father sleeping.
Very rare.
One cub is pulling the father's hair, and the dad is enjoying that.
This is very rare.
So, which requires more patience? I mean, a complicated heart surgery, which requires perhaps the maximum amount of precision. You talk about millimeters and seconds, or wildlife photography, where you have to wait for a perfect shot.
I think my cardiac surgery had taught me how to become a good photographer, have the patience. They're complementary. And sometimes I told you this, I sit from morning till evening. My best photos, I waited for full day in hot sun to get that one photo. I didn't want to leave. I didn't know when it's going to come out. And I thought I think it was there in the last exhibition. I'll show you that. This is my most famous shot. I waited for it. Yeah. This is
The
Lion King shot. Nobody in the world has this shot. I'll tell you a story.
The sunset happening at the backdrop.
This is where? Where is this?
This is Masai Mara.
Masai Mara.
Now, Masai Mara, entire Masai Mara, there is only one rock.
Amazing.
That's it.
That's it. It's been dream shot for 20 years. This lion cub with a father, 20 years my dream shot. Never. Always some element misses. Father is sleeping, the cubs cannot go, father is grumpy, there's a lot of grass. You cannot see. This is the only time I got it. Yeah. I was in the front of a 10,000 wilder beasts were there. They are just going to cross. This is that I went only for that. So my guide said, Dr. Panda, you always been talking about the lion. Or there's a lion sleeping on the rock. That was 11 o'clock in the morning. I don't know when the lion will get up. On 11 o'clock, I sat there till 6 o'clock, the lion won't get up. So finally, around 10 minutes before sunset, the lion got up, looked at me, and gave the best shot of my life, and then went back to sleep again.
Oh my God.
Nobody in the world has this particular shot. This particular shot is impossible. And my guide is one of the best guides. He said, I'm doing for 20 years. I never got this. Never got this.
Cool. Thank you so much for your time, sir.
That's
Really nice.
Thank you so much, sir. Thank you so much. That was Dr. Ramakanta Panda talking about his profession, passion, and everything that connects the two. The conversation is also a powerful reminder that the future of heart health depends on the choices we make every day. That's it for today. You were listening to this episode on the Morning Brief. This episode was produced by Anirban Chaudhary, sound designed by Rajas Nayak and Amrit Reggie. Keep listening to our shows wherever you get your podcast. Thank you and have a good week.